Hey, Dr. Curtis here. Wanted to give you a quick rundown on how to determine the difference between having just a common cold and influenza or the flu virus. This is something really I run into every single year, and this season is no different. It seems like we're seeing case after case after case of flu cases, type A and type B flu. There's a few key things that a lot of patients ask, and they try to decide: do I go to the go to the doctor? Got to go to the urgent care? Do I do this because, or is this just a common cold? This is really the dilemma that most patients have even before deciding to get care. A couple key things that help distinguish influenza versus common cold. Keep in mind, this is my clinical experience, and seeing literally hundreds in the last few weeks of flu cases. There's a few distinguishing features that most people can hang their hat on and say, okay, this is probably what I have, and seek care appropriately. So the first thing is fever. Influenza is very much characterized by fever. Children can have fever 102 to 103. Most adults typically will have a fever greater than 101. The other thing is body aches and headaches. So significant body aches and headaches, usually a very rapid onset. So people will typically say, hey, at 3 p.m. today, pow, I got hit by something. I felt awful. And everything got worse after that. That's a very classic flu-like symptom. The next one is a dry cough. So most people notice a weird tickly sort of, it jumps straight into my chest, dry cough kind of situation. Now it might progress to a loose or productive cough as time goes on, but usually in that first window they'll say high fever, body aches and headaches, dry cough, all of rapid onset. These are very characteristic of influenza. Also, I found that over time, when you see multiple flu cases, you start to see some trends of other symptoms that are like, okay, maybe their symptoms are a little milder, not as much body aches, not as much fever, but they have these other symptoms that go along with the sort of rapid onset. These things would be nausea and diarrhea. Those two are real careful. And then as a clinician, because I'm seeing patients and I see their vital signs and that type of thing, heart rate is another tip off. I've seen some people that say, well, I feel bad, I feel achy, I've got a little cough. They don't look all that sick. But you look at their heart rate and it's greater, it's like 115. It's 25 points higher than the normal resting heart rate. It's like a grown adult sitting in a room and their heart rate's 115. Why is that? It's because they have something more than just a common cold. So sometimes that's been a tip off. One other thing about diagnosing influenza, the flu tests are not perfect. I have seen, give you an example, it's nice when you get one positive. I think they're worth doing because if it gets back positive, you can feel very, confident, okay, you have the flu, let's at least go with treatment XYZ. However, the flu test I've seen multiple times. I have a family of 4 people, all sitting there in front of me, same exact symptoms. 3 will test negative, 1 will test positive. Do you think they all have something different? Do you think the other 3 don't have influenza? No, it's just the test isn't perfect. And it's nice when it's positive, but it doesn't rule out influenza. So what did I do in those scenarios? I treated all of them for influenza. It's not like one had the flu and the rest had a cold. They had the identical symptoms. So just understand this little clinical pearl there. Now, common colds, how do you know a common cold? I laid out the case for influenza, but a common cold is a lesser illness. You can feel bad. You can feel a little achy. You can have sore throats and drainage and congestion and sinus pressure and ear pressure. You can have all that kind of stuff. But typically, you're not going to see big fever. Typically, you're not going to see a 101, 102 fever with a common cold. Typically not. You're typically not going to see a tremendous amount of diarrhea or nausea and vomiting, things like that. Those are kind of more violent symptoms that you typically see with something like influenza. So when the symptoms are lesser, less fever, it kind of gradually creeps up on you over a period of time. It didn't hit you like a freight train. It's okay to just treat that and try to limp along and treat that as a common cold. Now, the point of my talk today was not to, how do you treat the flu? How do you treat the cold? Things like that. It was just to help you distinguish that, because I see a lot of people, well, how do you know if it's a cold? How do you know if it's a flu? These are the key symptoms. And I've distilled those symptoms out of seeing hundreds of patients for influenza just this season, not much less the rest of my career. So it's one of those things that, like, this is what I go by, and it seems to help patients get better faster. I hope that's helpful to you. might help you be a better patient when you can help distinguish your symptoms a little better, and you'll also help the doctor understand what kind of symptoms are most significant for you, and help them decide whether to do flu testing or treat you for the flu versus a common cold. I hope that helps you. Please leave a comment if this was helpful to you, or if you have more questions about this topic. Take care.